Hello and welcome to Laguna Beach, California. We are doing a live quantum demonstration on a tummy pot using our pinch pulse technique to get single session, side office, underlocal, body contouring results that exceed any other opportunity in the non-liposuction space. Single session, side office, significant fat reduction and skin tightening. And so the setup actually is very simple. You know, if you can, Dimitri, just show this little table here. You can have a little side table. All I really need are the instruments I'm going to use, the 10 or the 25, a little prep, some kind of square drape, and some local anesthesia. Now the local anesthesia is extremely dilute lidocaine. I'll talk about that, and how much you use and how much you deploy. And so I'm going to put on a pair of sterile gloves. This does not have to be in an OR. This is a sterile technique in your side office. And this can be like you're taking off a mole or a lipoma or something in your side office. It needs to be a sterile technique in a clean environment. Sterile technique in a clean environment. And so I make sure I have sterile gloves. And we're going to use a little chlorhexidine. Do I use any antibiotics on the patients? Yeah, just bring them over here and just turn them around facing me. No, bring the whole thing over, There we go. Perfect, like that, perfect. And so a sterile technique in a clean environment. You don't have to be in the OR for this. We're doing this at the Montage. I would never do this at a Sheraton or a Westin, but you know, you can do this certainly at the Montage. And if you can do this at the Montage, you're damn right you can do this in your side office. So I don't wear a mask, I don't wear a gown, usually just, you know, a Zegna suit and a pair of gloves. And I just make sure that we do not get an infection. This is a percutaneous technique. We're going under the skin, like you might do with your, you know, your fillers in the face. You don't want to drag makeup in. You don't want to drag bacteria in. So I do give them one dose of antibiotic about an hour before, either a cefazolin or a Clind if they're penallergic, and that's it. Maybe a Toradol, but no narcotic. You don't need narcotic for this. You don't need an anxiolytic. We use a little bit of nitrous oxide when we're doing the infiltration, and we use, first of all, this mesotherapy lidocaine. Roll that under for me, please. There we go. Usual technique. Excellent. Lift up. And if we just zoom in on this little bit of her belly that she didn't like, that pinched out 6 centimeters, I use this mesotherapy lidocaine, that's excellent, Dimitri, using this little 31 gauge 4 millimeter, and I do a percutaneous infiltration. That gets me down about 2 centimeters, about 2 centimeters. Now, you don't have to use this if you're not going to do the Morpheus. You can go right to infiltration with your 22 spinal, but I like using this because it spreads about 2 or 3 centimeters and makes the spinal much less painful. And so really simple little technique, putting a little bit of very dilute lidocaine. Now, how much lidocaine am I using here? I take 500 cc's of normal saline, and I dilute it with 2 bottles of 20 ml lido, with epi if you want, or without epi. You don't need epi necessarily. This is lidocaine for comfort. This is not lidocaine for liposuction. It doesn't have to be tumescent, just kind of spongy, just so she doesn't feel any pain. You could do this on dry fat and it would work. We're just doing this so that she is comfortable. So, mesotherapy lidocaine, easy to do. Many of you are using this already on facial anesthesia, or for the Morpheus for superficial cellulite or skin laxity when using assertive settings. So the same mesotherapy lidocaine. The lidocaine I'm using, very, very simple. I have 500 cc's and I take 2 bottles of 20% Lido with epi.